And we are going to go ahead and start. I am going to aim to finish up in about an hour. So it might go faster because I don't have like a real live crowd where I usually take comments. So it might be a little bit quicker than normal. Rebecca, did you get the request to record?
I have not, but I did manage to start recording on my side if I didn't make you host. Haha.
All right, perfect. So our topic today is social isolation and loneliness. And so let's get my introduction here. So my name is Helen Beeman. I have a master's of social work and I'm a licensed clinical social worker. I'm pretty sure all three of you that are on the call right now have been to one of my talks before. So I'll just zip through this. I am the older adult behavioral health specialist for both Lynn and Benton counties. I also help out sometimes for Lincoln County. And I come to you today with a little over 20 years experience in the medical, social, and human service fields. So what is social isolation? What is loneliness? Are they the same thing? How are they different? They often go hand in hand with how people experience them. However, they are different and they don't always happen at the same time. So social isolation really refers to a situation where there are few to none social connections or interactions, and loneliness refers to a situation that is a subjective experience. So you could be living in a tight-knit living community, maybe even in one building. You could have people all around you. You could even have a roommate that you're living with, and you could still be lonely. So it also involves the quality, our perception of the quality and meaning within the interactions that we have. So if you have a bunch of people around you, but you don't feel particularly connected to them, and the quality and meaning in those interactions is lacking for you, then you could still experience loneliness. Sorry, I don't know if everybody can hear, but there's there's construction work happening around me too, and I do have dogs in my house, so I guess I should give a warning before I get too much further. There could be barking and interruptions. So anyway, social isolation can be different than loneliness. Okay, loneliness is the more subjective experience, whereas social isolation is really where you are separated from other people and having those interactions and meaningful activities with other people. So again, while they don't always co-occur, they often do go hand in hand. And people who have people all around them can still experience the sense of loneliness. So we're going to start today by looking at the importance of understanding and starting the conversation around this topic. And I'll go over some quick facts and numbers so that you understand the scope and impact of social isolation and loneliness, kind of the costs around it, the impact on humans and our health and well-being. Then we'll look at risk populations and risk factors. So groups of folks who are more vulnerable to experiencing social isolation or loneliness, and then different factors that increase our likelihood that we will be impacted by one of these two things. We'll look specifically then at physical impact and then mental health impact from loneliness and isolation. And then we'll have one quick slide that just makes the connection between loneliness, depression, and suicide. And then we'll talk about a screening tool, very, very brief screening tool that you can use for yourself if you want to understand how at risk you potentially are. It's also a tool that you could bring to your primary care doctor's office and let them know it's something that you could potentially show to a friend or family member if you're concerned about them and want to just have something to start the topic. And then lastly, we'll finish with recommendations and resources for older adults. Because I am an older adult specialist, most of my talks are geared specifically towards that population. We also really focus heavily on any adult 18 and up with a physical disability, which our conversation before we got started with our talk today included a couple of different factors that, you know, it doesn't necessarily only impact older adults. I think that as a society, loneliness and isolation, you know, impact us, almost all of us to some degree at this point. And I have to tell you, the more I work with youth, I see that they are some of the loneliest humans in today's time. And I think a lot of that is because we use a lot of technology now, and on top of that, we're in a pandemic. So this really does impact everybody. I think maybe one of you is volunteer maybe with RSVP or senior or foster grandparent. So if you work with kids, to take into consideration, this talk is geared towards older adults, but this information is really relevant for any age group. So why do I think that it's important to start this conversation and be bringing up this topic and spreading information about it? We know that socially isolated older adults are much more likely to be ill and die sooner than healthy counterparts. So they also have much higher healthcare expenses than those who retain their social connections. There was a study in the last decade, which we would consider kind of recent, where they saw that about $1,600 a year more was spent on care for older adults who were socially isolated than those who were not. So I know $1,600 for some of us, that seems like a huge chunk of money in the grander scheme of things. If we're looking at Medicare spending for each person, that doesn't seem like a lot. For how many people are covered by Medicare in the United States, that is a huge chunk of money. And if you think about that, you know, potentially that's preventable spending. You know, if we keep people connected, that's something to really, you know, think about. And then we know that isolated individuals are more likely to require long-term care. That ties back into the fact that they're more likely to be sick or ill and then have a shorter lifespan. So they're gonna be more susceptible to needing some support in the end of life. Feelings of loneliness can negatively impact physical and mental well-being, really any area of your life. And we'll go into great detail about that in the next couple sections. And then we know that social isolation also adds increased vulnerability for folks to be abused or neglected. And I'll talk a little bit about that as we get to some of the other slides. So just taking a snapshot of who we see most likely socially isolated. Remember, this is where you're more separated versus that more subjective experience of loneliness, but they kind of do have some interplay there. Approximately 11 million people, or about 28% of folks age 65 years and older, lived alone at the time of the census. Okay, so almost 30% of our population, 11 million people, are already living in a house or an apartment or some sort of setting where they're by themselves. We know that as people get older, they're more and more likely to live alone because friends, roommates, family members are going to be passing away at higher rates. And we know that we're seeing this trend, and it feels new, but it's not necessarily a really new trend, but people are having fewer children. And historically, we have always really relied on adult children to be primary caregivers for parents and aging people. So we just have these natural caregivers built in, and as people have fewer kids, we're seeing that kind of pocket of caregivers diminish. So now we're going to talk about specific risk factors, and I think there's a couple slides of these. Now just keep in mind, if you have a bunch of these risk factors, you just want to be more aware about what that means. You want to have, you know, these concepts on your radar more so than if you're not hitting any of these risk factors. It does not necessarily mean, even if you had all of them, it doesn't mean that you are definitely going to be socially isolated or lonely. It just means that you might have to be more aware of it and work harder to maintain your connections so that you don't experience loneliness. So if you're 65 years of age or older, if you are female, we know females still in the US live quite a bit longer than males. If you are a widow or a widower, if you're living alone or in a residential setting, and almost every talk when I have like a large group of people, someone will ask me, what do you mean? Because aren't you saying either living alone or living with people? What I mean is either you're living alone, so think of in maybe a residential area in your own home, or you're in a residential setting where you're in your own separate apartment. So you're still living alone, but you might be in a different setting rather than in like a suburban community. People who experience chronic illness or poor health, and I know that seems kind of subjective or vague, and this can even be if someone perceives that they are in poor health or have poor health, they're more likely to experience social isolation or loneliness. And again, in the discussion before we started our slides, we even talked about some unique chronic conditions that people face, or even if you have a condition that requires certain medications that make you photosensitive or things like that, and you have different limitations that can create a situation where you find yourself more isolated. The next piece is folks who are functionally or mobily impaired. So if you rely on maybe a wheelchair or another person to help you get around, move around, that is going to increase your risk for social isolation or loneliness. And then someone who is sight or hearing impaired. Now, this one is interesting because a lot of people don't think about this. Because I work with older adults primarily, I hear all the time, you know, the importance of checking hearing aids, making sure that you're staying up to date on your lenses, your prescription lenses, so that you can see what's going on, you can hear what's going on. I would have sometimes younger people tell me, oh, you know, we try to get mom and dad out when we, you know, do our monthly dinner at Applebee's, and they just don't really contribute to the conversation anymore. So I feel like they don't even want to come out with us. So we haven't been asking them lately, or things like that. So these situations that can contribute ultimately to someone being a little bit left out or becoming isolated. And if you talk to that older adult, most of the time you find out, you know, if they're having difficulty hearing or seeing, it is really, really challenging sometimes to stay in a group interaction or to feel comfortable. If you've got a lot of competing noise, you're not able to sort through all of that and really comfortably participate in those social interactions. Some modifications, making sure that your hearing aids are in, that you have batteries, making sure that they're on, making sure that your glasses are clean, things like that, where you need to pay attention to all your stuff if you have hearing aids or glasses, and make sure that you get to those doctors to get all your needs met. But if you care for someone who has any of those things that you think about, you know, if you're having difficulty or something seems off, you know, I am always amazed at how dirty my glasses get so quickly. And, you know, it'll just a single little, you know, something or other on my lens can make me kind of feel motion sick or make me kind of agitated. And so it goes for all of us. So just remembering with these risk factors and thinking about this topic, it can be something really, really basic that increases our chances of being isolated. So if you're geographically isolated, literally, I'm thinking East Lynn, so Lebanon, you know, Lebanon is pretty isolated from other parts of Lynn County. You know, in Albany and Corvallis, everything's pretty close together. If you're part of a rural community, it just makes some of those things a little bit more difficult because you don't have as many people around. And then lack of transportation adds to that issue. We, you know, as Lynn, Benton, and Lincoln communities, we don't have a good public transportation system. And then if you have any other kind of conditions or challenges that make using public transportation or even taking a taxi or a cab. So if you are using a wheelchair or have trouble with sight or things like that, you're going to be even less likely to use other forms of transportation to get in, to have interactions and stay connected. Low levels of formal education is connected to higher risk. Low income is connected to higher risk. And folks who belong to LGBT community, so lesbian, gay, bisexual, and trans, and then are also within the older adult population, are really, really significantly high risk of being socially isolated and lonely. This actually is true for LGBT folks of any age. So just some things that inherently create a little bit more risk for isolation. And then caregivers of older adults. A lot of our caregivers, again, are still adult children, or even older adults themselves who are, part of our younger, older adults, and they're providing care. And there's a lot of reasons why caregivers are at higher risk. The majority of what I see is that caregiving for anybody just requires so much of your time and energy that a lot of people don't necessarily have enough time to stay connected to their own social connections, while also making sure that they're helping somebody else really take care of every aspect of their life. So now looking at effects on physical health or medical. So we know that social isolation and loneliness are associated with a higher risk of mortality. And this higher risk begins around age 52. So if you're 52 years of age or older, you already are in a higher risk category. And the numbers that I found when I was initially putting this slideshow together many years ago was that on average, it shaves about 7 years off of a person's lifespan if they're isolated or lonely. So 7 years for me, I just round numbers, and that's losing a decade of your potential lifespan. So if that doesn't get your attention, I don't know what will, but to me, that was fairly alarming to learn. We know, again, that it is linked to long-term illness. So chronic illnesses, things like that, which then in turn connect to those statistics that we saw earlier, where folks are going to require higher payout for Medicare expenses, more likely to need long-term care, things like that. We know that there is a direct causal link between loneliness and high blood pressure. So, if there wasn't a causal link, I'd say there's a correlation, right? We know two things are connected, but we can't say what causes what. But loneliness has actually been proven to cause high blood pressure. So loneliness is not good for your health in any way. And then lastly, lonely people engage typically in more unhealthy behaviors, and that includes even dietary choices. So what types of foods we're choosing to eat. Generally, these folks are going to be less physically active, and they're more likely to smoke cigarettes or use tobacco products than people who are socially engaged. There are a lot of different reasons why this information is correlated. I just think, if you're constantly around people, every time I try to eat healthier or start an exercise program, almost always I'm not doing it by myself. And I certainly think if I were to ever take up smoking cigarettes, I know in real short order, I would have a lot of people crabbing at me to stop smoking or to help me quit smoking. So it's things like that that contribute to that connection. And then effects on mental health or psychological well-being. So even the perception of loneliness, we know, contributes to a decline in cognition and an elevated risk of developing dementia, which is a brain disorder. The most common one is Alzheimer's disease. It's actually very, very common in this country. And so when I say cognitive decline in general, I mean all the ways that our brains function to help us be independent. Things like time management, reasoning, problem solving, things like that. All of those are pieces of cognition. If you've attended my brain health talk, you got a really in-depth lesson on all the different facets of cognition. And so we know that people who even perceive that they're lonely or actually are lonely, that if they take a cognitive test or screening tool, they perform worse than their peers. And then also, that increased risk of dementia is a really big deal. So loneliness is also a major risk factor for depression among older adults. There's a connection there. Isolation leads to feelings of pessimism about aging and increases fears or anxiety around the future. And if you look too deep into psychology around, how our perceptions and thoughts about things impact our reality, the connection's very real. And so if you are in a situation where you are constantly feeling negative or fearful, around, you know, becoming an older adult, getting older, this later stages of life, anything like that, it really does change your experience of things. It's not good for your health, and it can actually spread from, you know, you to all the people around you in your space. So we want to definitely try to nip that in the bud. And from here, we're going to make that connection. Okay, so I've already talked a little bit about depression, things like that. I want you to know that there are clear connections between these things. So looking at the significant correlation between depression and loneliness, and we see that because there's a frequency of co-occurrence, which means these things are happening at the same time very often. So people who are lonely are often experiencing depression. People who are depressed often have the perception of loneliness. Here's the piece that I was talking about before. I won't say, you know, this causes this. We don't know, but we know that those two things go hand in hand more often than not. The last piece is that older adults have some of the highest rates of suicide, and it's kind of thinking about, everybody asked me, what do you consider an older adult? So for the Older Adult Behavioral Health Initiative in our state, which is where my position comes from, we talk about older adults being anyone 64 years of age or older, so Medicare age or older. And within that age range, 64 through the end of the lifespan, which is different for all of us, there are smaller pockets of age ranges that have just outrageously high rates of suicide. So it's something to think about, because if we know that somebody's lonely, if we notice that we're lonely, if we're experiencing depression, either one of those, knowing the correlation between the two, we also need to be thinking about the risk of suicide, whether it's for ourselves, for our family, for our friends, for maybe the people that we provide care for. And here's a risk, or here's a picture, it's of Robin Williams. And I probably don't need to explain who that is. But this was a quote that I thought was really meaningful. It says, "I used to think the worst thing in life is to end up all alone. It's not. The worst thing in life is to end up with people who make you feel alone." So Robin Williams died by suicide several years ago. It seems just like yesterday. But I mean, it's my opinion, but he seemed like one of the happiest, funniest humans on the face of the earth. I always think of Mrs. Doubtfire when I think of him, but it was an incredible shock to most of the world when he ended up taking his own life. And I think this quote just really amplifies this perception of loneliness. And we each have different expectations and different needs around meaningful interactions, meaningful connections. And it's even something as simple as, like, you know, people will say, oh, my family's blood, so I can't end this toxic relationship with them. Or people will say, you know, the very opposite is like, we make our own family. So you could have a family made of people that you have no genetic relationship with. But what's really, really not good is if you end up surrounded by people that you just don't feel connected to at all. That's going to create some serious loneliness for you. So this is a fairly brief scale that people can take, and I can, if anybody's interested, I can email it to Rebecca or email it directly to you. If you'd like it printed out, I have a ton of them printed, and I'm happy to snail mail you a copy of these, or if you would like a bunch of them, just let me know how many you like. This is called the Geriatric Depression Scale, or GDS. It's comprised of 30 items. There are shorter versions of it. If you don't want the long version, you can let me know and I'll get you a shorter version. As far as looking at this tool, it is valid and reliable. So all of our tools that we send out in the mental health world or the psych world, we make sure that it measures what it says it's going to measure, what it's designed to measure, which in this case is depression, and it measures it consistently and well from every single time that we administer the tool. So it's a good tool. The short form is what we have pictured here, which is 15 different questions. And this is just a screenshot of part of it. So if I had included the entire screening tool, you'd see at the bottom, it tells you how to total up your score and what that score really means. But I tell people, even if you just glance at it and read through them, you don't even necessarily have to mark on the sheet or do any of the calculations. It'll give you a pretty good idea of, you know, if you need to take this tool into your primary care doctor's office, or if you already work with a mental health provider, do you have concerns about depression? And again, you can use this tool to start the conversation. If it's, you know, your own health that you're concerned about, bring it into your doctor's office. We don't really know all the reasons why, but we know for sure that older adults who go into a primary care doctor's visit are much less likely to be asked and screened for mental health. So more likely if a 100-year-old version of myself walked in to my doctor, who I've been with for 30 years, and said I have, you know, a lot of stomach pain, things like that, you know, they would most likely think that there was a physical problem with me, and they would probably give me, you know, antacids or something to help settle my stomach. If I walked in, 37-year-old me, and said the exact same symptoms, it's much, much more likely in today's medical world that that physician would at least ask me about mental health. And so if you've got tummy ache and it's actually because of depression or anxiety, they might miss it if you're an older adult. So sometimes we really face the burden of taking our own screening tools in, starting those difficult conversations, reminding, helping to really get those doctors thinking about mental health for older adults. So enough about the problem. We're going to start talking about all the different ways that we can help either reconnect for ourselves or help others reconnect and either prevent or try to help eliminate this sense of loneliness. So learning something new is a powerful tool that we can use. There's a lot of ways that we can learn something new, which will drive making new connections. So take into account that we are now in a pandemic, and I haven't altered this slideshow to take that, you know, into the equation here. But there are tons of things that have shifted to being online, just like we're doing today. There's lots of classes. You can do, you know, meetups, coffee hangouts, things like that. You can do it over the internet. You can use all your different technology to accomplish those things. And for a very long time, you've had, you know, the option, if you're computer savvy, to always go into chat rooms and things like that, or use emails to maybe start the process of finding a new hobby or skill that you'd like to improve. Community education classes are still going. I would say at this point, especially if you're an older adult, make sure that you do digital platform online learning versus trying to go in. If there are education classes that are happening in person, even if they're socially distanced with masks and all the things, I would still make the recommendation, since we're so kind of early into this, that you do online based learning until probably next year. There are health education classes. We are lucky to have Lynn Benton Community College and OSU in our communities. They offer a ton of web courses and things like that. And then we have a bunch of little satellite campuses where you can go and pick up a new skill. So staying engaged, we want to avoid social isolation by staying connected to our social network. In my 37 years of life, I'd say this is a process that kind of ebbs and flows based on what's going on with our lives, based on what's going on with our friends and families' lives. The pandemic has certainly made things more difficult. But I think sometimes we go through this process of making new connections, having close relationships. Sometimes those go through a period of attrition, and then we find ourselves with maybe a smaller group, and then we need to build that back up again. And I'd say, you know, looking at my life, that's happened, you know, more times than I can count, where we're just kind of building new relationships. Some of them phase out, and then you want to start building new ones again, so you always have a healthy social network. Volunteering is a great way to make new connections. Also help keep you busy, and distraction is a great technique for dealing with things like anxiety and depression, feelings of loneliness. So volunteering in this current pandemic situation, it'll just require you to be maybe a little more creative. I think most places that require volunteers, that really need them to manage what they're doing, have probably figured out ways that they can utilize volunteers in a safe manner, or maybe even helping people with online work that they need, whether it's maintaining a Facebook account or really anything. So that would just be a matter of, think of something that's meaningful for you, a cause that's important, and then giving those folks a call or going on their website and figuring out what kind of opportunities exist for volunteers. Lastly, making sure that we utilize our technology, especially if getting around either physically or with transportation are barriers. And then I probably should add in here, or if you're caught in the middle of a pandemic, hopefully a once in a lifetime pandemic for all of us. But thinking about all the different technology, so we've got our computers, we've got our tablets, we've got our smartphones, all sorts of ways that we can use the different programs that are already on most of these things when we purchase them, using applications that we can download. There's a ton of free stuff, so I'd always urge you to look at free apps before you buy something, even just on your phone, using things like Skype or FaceTime to connect with family and friends. And behavioral activation, which is a fancy made-up way of saying move your body, keep moving your body. This is, again, another powerful tool against prevention and combating things like anxiety and depression that go hand in hand with social isolation and loneliness. If you want to start a walking group with friends, we know that the spread of COVID is very, very unlikely if you're out in fresh air outside. I would always recommend, if you're able to wear a mask, and of course maintain social distancing even with a walking group. I've seen people out at parks and they all have social distancing. They're all in their own separate blankets, and they bring their own picnics. So feel free to get creative. It's more important now than ever before to figure out how we can still stay connected and have a good time with our friends and family. Bowling league, again, this is one of an older, not updated for the pandemic type of recommendation. So I would not advise at this time any indoor activities where you're going to be closed off from open air, and you're going to be, especially with bowling, I just think of, we share the shoes, we share the bowling balls, no. And then group exercise classes, I'd say if you can be part of something that is outdoors, I would recommend that. I personally, and it's up to each of us to decide what kind of risk we're willing to take, where we're at with that, but I'm not comfortable going inside of a gym and doing exercise classes. We know that heavier we're breathing, things like that. If somebody does have the coronavirus, they're going to be potentially getting more of the virus out into the air when they're breathing heavily and exercising. Not something I would recommend at this time. And then we know the more we move our bodies, the more likely we are to experience the extra side effects or benefits from that, which could be an improved mood or better quality sleep. So this is one of those things where a lot of people focus on this. They say, I don't feel good. I want to get in shape, or I want to move around more. My body's sore, which can happen with anxiety, depression. A lot of people think about walking, moving around, getting exercise. And that is part of the picture. But we also want to make sure that we move around and we also keep our mind active too. So here's one of the resources that is available to you or anyone. This is a California-based resource. It's called the Friendship Line. It's been around for a really, really long time. The gentleman who created the Friendship Line, I think he's in his 90s at this point. This is a free and confidential warm line. And as you can see there, it's a 1-800 number. It is toll free. However, if you're going to use a cell phone, just make sure you take a look at how that's going to impact or use your minutes. I imagine for some people, if you have unlimited minutes, you don't have to worry about that, but toll-free numbers sometimes don't work the same on a cell phone. So this warm line, it's not for people in crisis. It's if you're lonely, if you're isolated, if you need an ear to talk to. So any person age 60 years of age or older any person age 18 or older with a physical disability can use the line, and then any caregiver of those two populations is welcome to use the line. David Romprey Oregon Warm Line is the Oregon version of that. It is peer run, which is really cool because you know you're going to call and somebody on the other line is going to pick up who maybe has similar experiences to you versus someone who maybe is, you know, fresh out of high school and going to college and learning cool stuff, useful stuff, but maybe doesn't have as much life experience. This is again free and confidential. And the National Suicide Prevention Lifeline, free and confidential. This is a 1-800 number again. This is a crisis line. So if you or someone you know is experiencing suicidal ideation or is even further along in the process where they're actually thinking about killing themselves, creating a plan on how they would do that. What we know about folks who are experiencing suicidal ideation is that most people are actively suicidal. So the highest risk of acting on that for about 25 to 30 minutes. So what that means for us is that if we can get them on the line, we can keep them safe and get them connected with resources so that we get them through that high risk period, keep them safe, and then we can go from there to get them whatever they need to get to a better place. So just in summary, volunteering can reduce social isolation and loneliness. Okay, it tends to help us feel good as human beings to have a purpose, to feel like we're contributing. It's also distracting at the very least. And most of us do enjoy being around people who have shared interests. Taking educational and training classes. Maybe you need to take a community education class to learn how to use the computer or to learn how to use all the cool applications on your smartphone or your tablet so that you can have more options to stay connected. Physical activity in the form of group exercise is really effective because then you get that behavioral activation with the movement, the benefit for your physical health, and also being around other people is a great idea. Again, during this time, I would only recommend doing those groups if they're outside. And then utilizing all of our different types of technology, including video chat, Facebook, the various hotlines and warm lines. There are text lines as well. There's text lines specifically for youth or veterans. So if you're part of a subgroup that's really specific and you have specific needs for who you want to engage with, you can let me know and I will find you the best connection for that. And then even thinking about things like hearing aids, all of our other different technologies that help us stay connected. So my ask for you all today is, start talking about this topic. The more that we talk about it, especially if you have experienced loneliness or isolation or you currently are dealing with it, a lot of people experience this, especially at some point in their life. And right now during a pandemic, it's a really big issue that everybody's trying to deal with at the same time. What happens with anything like this is that there's usually some stigma around that. Some people will think, I'm probably the only one that feels like this, or I must be emotionally weak to feel this lonely, to feel this sad and disconnected. So a lot of times people won't talk about it or they won't get help if they think that they're the only one. So if you feel comfortable letting people know about the things that you experience, bringing up the conversation, spreading information about it, it ultimately will help people, start thinking about this, potentially discover that they are dealing with something like this and get help sooner. Just be aware of your risk factors. Okay, so again, if you had every single risk factor that I said, it doesn't mean that you're going to absolutely be isolated or lonely. It just means it needs to be on your radar. If you want that screening tool, let me know. Understand your community resources and please use them. Don't be shy. And if you can, if you're part of any advisory committees or things like that within the community, please continue to support and start the conversation about improving our public transportation system. And we are done. So if there's any questions, I can take those now.